It is absolutely my pleasure today to introduce Dr. Jennifer Garner, who is a registered dietitian and associate professor of food and nutrition policy at The Ohio State University. She has a dual appointment in the College of Medicine School of Health and Rehabilitation Science and the John Glenn College of Public Affairs. She was hired via the Ohio State's Initiative for Agricultural Transformation to conduct research at the nexus of our food system, diet, health, and policy. Leveraging mixed methods, Dr. Garner evaluates community-based interventions designed to improve community food security and reduce individual and household level risk of food insecurity and chronic disease. Specifically, her team works to advance our understanding of the nutritional, health, economic, and social impacts of programs designed to connect households to healthy foods via local food systems. And for the students in the room, I did want to, as I had found when I was looking up and making sure I'd done due diligence, so I was prepared to listen. In her path to becoming where she is now, she was not going to be a researcher, rather going to be a clinical dietitian. And the way that the path she found to the PhD program included a very, very cool sounding program at Cornell, where her internship was combined with her PhD program. So I'll leave it to you to discuss if you want those cool opportunities, but I did want to say, I also found that as a PhD candidate, participated in a podcast with the Academy of Nutrition and Dietetics about communicating scientific research. So even as a student, she's been an excellent translator of science, which is near and dear to the nutrition, the dietetics and nutrition professionals' heart to make this accessible for all. So if you could, let's welcome Dr. Garner, and I'm so excited to hear about this level of research.
Oh my gosh, thank you for that amazing and so kind introduction. And I would love, we could talk for an hour about career trajectories and, you know, the best laid plans. I actually just talked with my research team today about planning, you know, having a 5-year plan, but it's good to have a plan. Things change, and I would love to answer any questions you might have about that and why I made that change. But for now, you know, I'll dive into the research. I know it sounds like a lot of you are looking forward to this presentation. I really appreciate that. And some of you, as you came on, might have heard me thanking all of you for the invitation to talk, because we know the pandemic has had just such disastrous impacts for so many households across the US. And it seems a little selfish to highlight this, but I think within the bubble of academia, junior faculty and junior researchers in particular, it's starting to emerge some NIH research about the impacts this is having on our career trajectory potentially. And so, you know, as a lot of us we're sitting home, especially last year, you know, trying to get work done with one or more kids at home or other caregiving or family responsibilities, to know that there are others who are interested in this work and excited to hear about it. It was just like such a little spark of affirmation. And I'm just really grateful to all of you. So thank you for being here. So let's dive in. So I'll start with, you know, I highlight pretty much every talk is focused around food security. And now more than ever, that's a major concern in the US. And, you know, it's kind of ironic. Despite our status as a high income nation, over 10% of US households face food insecurity, which is the limited or uncertain access to adequate food. And that 10%, that was the estimate before COVID. And so we have yet to see the final USDA Department of Agriculture estimates for 2020, but there are many estimates saying it has risen drastically. So this still, even pre-pandemic, equated to 13.5 million households who were, meals were being skipped, food intake was being minimized, and food of poor nutrition quality was being emphasized as a means to stretch household resources. That's what we see in food insecurity. And so of course, that's a major concern to those of us in the nutrition world. A substantial body of literature, of course, supports the relationship between food security, given what I just said, and individual health and well-being across the lifespan. And yes, that's in terms of diet quality, that's in terms of health and chronic disease impacts, but it's also, there's just such a fascinating body of literature on food security in relation to educational and developmental outcomes for children and adolescents. And mental health outcomes and financial well-being among adults and households. And so really there is this ripple impact of food insecurity that makes it an important target of intervention. Of course, there's also growing focus on rural economic development and enhancing support for small and mid-sized farmers who are perhaps less supported through traditional avenues of the Farm Bill in particular supports farmers, but there's less support for small and mid-sized farm operations, and particularly those focused on specialty crops, which, as much as I hate that term because it indicates something kind of special or unique, fruits and vegetables fall into that category of specialty crops. And there's really increased concern that farmers growing fruits and vegetables aren't sufficiently well supported. So enter community or local food systems. As a consequence of this trio of concerns, we're seeing increased investment in local food systems. And I just mentioned the Farm Bill, so I'll bring that up again. And a key example of this heightened investment in local food systems is now there's permanent funding in the Farm Bill for the conduct and evaluation of projects that incentivize the purchase of healthy foods and of fruits and vegetables in particular among low-income consumers. So there's many examples though of non-incentive models as well that are aiming to achieve this triple win, if you will, including those that I'll be discussing today. But first, I do want to give you some regional context. Certain regions, such as the Appalachian and more southern portions of the US, do consistently experience greater rates of food insecurity or greater prevalence of food insecurity than others. And Ohio, unfortunately, is among those states experiencing higher amounts of food insecurity relative to most other states. And those of you in Missouri, you're about average, for better or for worse. It's still, I think it's an issue across the entire U.S. really. In Ohio, there's certain parts, of course, that are experiencing it worse than others, and the Athens area fares worse. So what we see in the southeastern portion of Ohio, which really overlaps with the Appalachian region of Ohio, it has a food insecurity rate of nearly 1 in 5 households. It also is the only county in Ohio where low employment overlaps with persistent poverty, overlaps with persistent child poverty. And so, of course, all of this goes hand in hand, but this is an area of just really unique need. But what these statistics belie for community engaged researchers in the field, that the statistics never give the community its due credit. This really belies the region's rich assets and robust local food system. There are 2 local food system efforts in particular that were the focus of this research: Country Fresh Stops and Donation Station. And this is what I'm going to show you is a very simplified graphic to demonstrate the flow of regional produce from local growers to local consumers through these 2 programs. Of course, you have the farmers, and for the purposes of this simplistic model, they are selling their produce primarily, and this is true, primarily at the produce auction in the region, the Chester Hill Produce Auction, and the Athens Farmers Market. So in Country Fresh Stops, the locations affiliated with this model, they set a budget, and the nonprofit Rural Action essentially acts as a liaison between the farmers or between the auction and these sites. And what they do is they act as a buyer at the auction and purchase produce at a value in line with what the sites dictate. And they deliver curated bundles of fresh, locally sourced produce to each location at a mutually agreed upon interval, typically about weekly. These locations then resell the produce to their regular patrons, whether that be the sites involved in this program include your typical kind of convenience stores, but they also include pop-up markets at healthcare sites. So kind of like mini farmers markets that are specifically designed to be at locations where individuals, especially at heightened chronic disease risk, might be interfacing. In Donation Station, the coordinating nonprofit is Community Food Initiatives. And what they do is they reinvest monetary donations that they receive as an organization to the Chester Hill Produce Auction. That is, they also act as a buyer at the auction, using those donated funds to purchase fresh produce. And they also noted here with the arrow from the farmers market, they do also solicit monetary donations and donations of produce at the local farmers market. So that's kind of a secondary or supplementary source of fresh local produce for them. What they do then is they host these distribution events. There's one site right in Athens, Ohio, where organizations, food pantries, and prepared meal sites can come to access this source of free locally sourced produce for their sites. And they can collect this procured produce, and then they can redistribute that to their clientele, either in the form of pantry pickups, produce boxes, direct deliveries, or using the produce in cooked meals in some cases. Okay, so that was the simplified schematic. This is obviously the reality is that these models are much more complex than what I just gave them credit for. And this is a schematic that we produced at one of our initial team meetings, where you see up in the upper hand left corners where farmers are indicated, and then consumers at the bottom, and just arrows and flow of money and resources and values in every direction. But I think, hopefully I gave you the necessary context for this talk. Before moving on, though, I want to make sure that another key distinction is made between these two models. And that is that one of them, Country Fresh Shops, is really what we might call a market-based model, and that it's integrated into the existing business operations of the sites that are affiliated with Country Fresh Shops. Whereas Donation Station is what we might call an assistance-based model, where the mission of community food initiatives and of this program is fresh and local food for all. And it's a program in which affiliated sites and their patrons can access and benefit from this resource and from the produce at no financial cost. Of course, a little foreshadowing here, their costs can be incurred in ways that are not financial. So, in partnership with our community nonprofit organizations that I mentioned, and also an amazing group that I'll introduce to you at the end, an interdisciplinary team of Ohio State scholars, and of course my own research team, we collaborated to define our purpose. We knew these models represented something potentially novel and important to understand at a deeper level, both for scholarly work and also for on-the-ground benefit of these nonprofits managing the programs. We ultimately decided and agreed upon this objective, which is to understand and compare these models' sustainability and potential outcomes. Between these two programmatic models, which kind of work in similar ways, but also have their differences, as I explained, but both are designed to leverage the local food system for the benefit of multiple local stakeholders. Stakeholders being, for example, the farmers, and the community sites participating, and of course, the ultimate end user, the consumer. To achieve this objective, our team conceived and implemented a longitudinal mixed methods evaluation of the two models. And it's really composed of three distinct and publishable, which is important if you're an academic, but really interrelated phases. And so let me go through, I'm going to go through each one and share our work. So we started with a qualitative study of the major pre-consumer stakeholders, including the farmers here indicated by this little icon, the nonprofits involved in these models that I explained to you, which includes both rural action and community food initiatives, but also another organization, the Appalachian Center for Economic Networks, which graciously offers more of like in-kind resources to these models, including the use of space, warehouse space, where the distributions take place and some office spaces are at. And we also wanted to talk to the sites and for both the CFS model, the Country Fresh Stop model, and the DS model, the Donation Station model, that are participating, to really understand their on-the-ground experiences of participating in and being affiliated with these models. So we conducted 28 interviews with individuals across these domains. And when possible, for the qualitative researchers in the group, we did record and transcribe those interviews so that we could analyze them in vivo, which, for those of you who aren't familiar, is a software that facilitates the analysis of qualitative data. And essentially, you could think of it as when you're in a Word document, you know how you can highlight text and then create like a bubble comment? It's kind of, that's a rudimentary analogy, but it's kind of like that, where you can highlight text and define, capture the meaning of aspects of what was said throughout the interview. And then the software allows you to analyze that and see how that meaning that emerges kind of compares across different interviews that were done, to help you figure out what the major themes really were, what was coming up most often. So I'll talk a little bit more about qualitative analysis in a bit for those who are less familiar. But I do want to note that we definitely would have liked to talk to many more farmers. You can imagine that 6 farmers is far fewer than is, that really play a role in this model and that contribute to the plethora of produce that is available at the auction. And the auction really being the main source of produce, of local produce that is feeding into both of these programs. Unfortunately, you can see the timeline here, January to March of last year, we ran up against COVID research restrictions, quite honestly, and the inability to leverage technology because, interestingly, the majority of actively engaged farmers contributing to the auction model are of Amish tradition. And so just, we couldn't really use the technology that we are using here to talk virtually. So that's something we're hoping to go back and do more of. But we did what we did and actually still were able to find some insightful things that I'll share. Before I dive into that though, qualitative research, it seems murky for those who haven't done it. So very briefly, for those less familiar, I just want to share a schematic of our coding process. Our process started by looking through all those transcripts for all the conversations that had been transcribed and identifying codes that really captured the essence of meaning of the thoughts and ideas that had been expressed in the interviews. So 3 of us engaged in this process and generated a list and compared notes. And this really reflects all of our ideas for coding, organized into categories that are reflective of really the interview guide sections. And I will note too that we, as much as possible, tried to have the interview guides across those stakeholder domains be pretty comparable so that we could look at major themes both within and across stakeholder categories. Okay, but this is what it looked like after we went through iterative stages of discussion, debate, multiple rounds of coding and recoding, and ultimately came to a consensus on a codebook that could be applied consistently across both of the Country Fresh Stop and Donation Station transcripts, and really encompassed 4 more simplified domains. But when we took a step back, really 3 broad themes related to program sustainability emerged from this effort. And you might recall part of our objective was to look at the sustainability, to both understand and compare the sustainability of these models and to look at their potential impacts. For now, for the purpose of this talk, just to make sure we have as much time for discussion as possible, I'm going to focus on these themes related to sustainability because I do think that's at the core of these programs' potential to have impact. For them to have impact, they have to have durability in the community. So these 3 themes were the facilitating power of mutual benefit or mutual values, the hindrance of the inherently seasonal ebb and flow of these programs that rely on the local agricultural calendar. And, we're not in the southern US here, we're in the Midwest, and we have periods of seasonality. And so how do you grapple with that? And finally, program stewardship, which is an interesting factor. It seemed to both enhance and compromise the sustainability of both models. So with that teaser, I'm going to dive into each one. What promotes the sustainability, or what seems to promote the sustainability of these models, is also what drives our growing interest in them, which is the potential for mutual benefit. So I have these times where I'll tell my parents about my research, and not coming from a research background, they'll be like, duh, like we could have told you that. How much money did you spend and time on that? But I think what we learned here is, yes, maybe it's not surprising. There's of course mutual benefit, and I think something that our partners were constantly reminding of us through this process is that these aren't supply chains, they're value chains, because really they encompass more than just the transaction or the flow of goods from stakeholder to stakeholder. So again, this wasn't necessarily surprising, but I think you'll see that we gain some more specific insights to how this benefit emerges across these categories. Okay, and why I have supply and demand on here is because really the programmatic models seem to succeed in aligning not only the values, which we would expect based on this being a value chain, but also influencing the supply and demand positively among the pre-consumer stakeholders. So let's start with the farmers. Farmers reported the pivotal nature of the auction to their farming strategy. That is, for example, what they chose to grow each season. They really, and I was gratefully invited to one of their meetings. It was hosted by one of the main Amish farmers in the region. Big, big house, big wood table. All the major farmers were around it. A lot of the nonprofit stakeholder representatives, and just having this conversation at the end of the growing season about looking at transactional data from the auction and what sold, what didn't, at what rates, how did it fluctuate, and collectively coming to decisions as a group of, as a stakeholder group about what they were going to grow in the next season and how they were going to prioritize their resources. And so it's really pivotal to their livelihoods. And I think there's a lot we could say too about there being a preponderance of Amish farmers in that community, because they aren't quite frankly as tapped into, and they don't want to be tapped into traditional supply chains, global supply chains. So the localized nature of these models really works in their favor, and there is that clear mutual benefit then. The reality that country fresh stop and donation station related purchases are a driver of demand at the auction. And that's actually something we are exploring in more detail using that transactional data that I just mentioned. So really there's great alignment for the farmers. For the nonprofits involved, these models represent the epitome of their values and allows them to partner and to share resources while also working to benefit the stakeholders of greatest interest to them. So for example, rural action is primarily focused on helping farmers. That's their stakeholder of interest, their prime beneficiary. Whereas community food initiative cites the end user, the consumer, as their beneficiary of greater interest and concern. These models allow them to work together, share resources, apply for grants collaboratively, while still, primarily focusing on their stakeholders of interest. And so, this was a great quote from one of the partners. We've all recognized that we bring different contributions, different assets, and different frames of reference to a lot of this work. So there's always been that synergy. And so I just think, as we think academically about this work and about the synergies of different organizational partners, kind of what can we learn from this model about advancing unique needs and identities and missions while also leveraging overlapping missions? For the sites that were affiliated with each of these models, these programs were often the only or the best means by which they could source fresh produce for their patrons. For CFS sites, their rural locality precluded them often from purchasing from more traditional supply chains and tapping into that network that, say, larger retailers might, like the Walmarts and the Krogers. And also, obviously, they don't have the demand, so they're not as appealing of a stop for some of those supply chains. For donation station sites, most of them, it was really interesting. It's something I want to look more into. They purposely opted to not be part of the Feeding America network for various reasons. And so, this filled a key gap in their food sourcing options, specifically as it relates to fresh produce. And one of the sites said, quite frankly, I don't know what we would do for fresh produce if we didn't have donation station. And so, I think this again comes down to the shared values here, and they want to be able to provide this, and this being one of the main reasons for them to do so. So we will talk a little bit about the challenges they experience, but given that this is really a unique opportunity for them, that really does drive their long-term interest in taking part and being a part of these models. And the community, or on the CFS site, the Country Fresh Stop site, this store owner was talking about talking us through why they participated in the model. And they said, I don't think we would have moved forward if it wasn't locally sourced. The produce auction is such a massive operation that we were pretty confident we could have a good quantity and variety of produce on a weekly basis. So they knew there was that kind of reliability there. That was that local knowledge of where this was coming from and what they could expect. And I think also the primary reason we wanted to move forward was that economic development piece. So often we heard these stores, especially for the CFS model, just talk about, we're part of the local community. We want people to support us. And so there's some reciprocity there. We also have to support our fellow local organizations, our farmers, and other local stakeholders, and be a part of that vibrant economic development that the region wants to see. Something that was slightly unexpected was the way that representatives talked about their own personal values in relation to the models. So, like I said, many of them talked about the organization or the site's mission to serve the community, but many of them actually seemed to internalize their role in making these programs happen and making them succeed at their particular site. And they contextualized the program's value in relation to not only their business or operational missions, but also their own personal values and mission. So this, I just want you to keep that in mind because it's going to come into play later with one of the later themes. Of course, I would be remiss if I didn't remind you that what was not studied in this phase of the research was whether such mutual benefits were perceived by the ultimate end user, the consumer, which those of us, I'm sure, share, as a dietitian and those of you in other health related fields, obviously the consumer is often our main stakeholder of interest. But I think what this is helping us to appreciate is that there's so much that comes before and influences the resources available to consumers and to local community members. So let's talk about something that seemed to hinder the sustainability of the models, and that is the seasonal ebb and flow. This was a key factor that confounded the benefits achieved via mutual benefit and value alignment, like I just talked about. And it's of course inherent to these models because of the local agricultural calendar, like I mentioned. And so the site kind of painted it out for us what that looked like for them. They said, yeah, just getting used to the whole program. It was not known really, not well advertised. And we probably threw more produce away or gave it away than we sold. But then it kind of turned around later in the season and I had less waste. Seasonality, essentially what it means for these sites is that they can't get through the hurdle of incorporating the produce into their operations and then move into like a routine maintenance phase. So, in behavioral interventions, we would have, we think of stages of change, a trans-theoretical model, and, where people are along that stage and ultimately getting to that kind of maintenance stage. But this program, from a programmatic perspective, we could think about that same model and process. And that's just not happening because throughout the season, they're having to adapt to different types of produce and their unique handling and storage needs. So later in the fall, you have squashes, which are great because, they don't have to be refrigerated. They're pretty hardy. They're not going to wilt on you. But in the beginning of the season, you have a lot of greens and greens are so fragile. So just a lot of different needs. They're also having to address patron confusion about the lack of confusion and frustration about the lack of variety compared to other larger retailers. And so, we had other quotes and anecdotes from sites talking about, people specifically telling them like, why would I buy produce from you when I can go to Kroger and just like select whatever I want? And as a mom myself, household preferences, child preferences, all of us have food preferences. I know my son in particularly, he loves bananas and oranges, which you're not going to get through a local produce auction in Southeast Ohio. And so, there's things like that the sites are having to grapple with. And then, of course, as the season wanes, they're handling patron frustration to the fact that it's no longer available. And so this representative said, wintertime is tough because we're not getting as much produce. They do to get some, of course, like I said, some squashes, potatoes, carrots, things like that, but not as much. And then especially as people start relying on that and are more accustomed to getting that produce, when that dies off, they're like, where are my veggies? So that's great. We love to hear that. As a dietitian, I love to hear that. But then, of course, it kind of goes away, it wanes. And then when the season starts again, the site goes through that whole process of doing what they can to make sure that the supply of this very perishable product is met with demand by the local patrons that they serve. That brings us to program stewardship. Participation in these models was not without cost to the sites. And so I gave you that foreshadowing earlier. And even if not financial, then in terms of time and effort, which I think we can all appreciate. So this site representative shared with us, I just really love this quote, and I'll explain why after I read it to you. She said, everyone that we have come in contact with, the people at donation stations, the people at the nonprofit, the people at the auction are so giving that how could we not? And we can help other people. The cost, yeah, it costs some money, but not that much, We're not overly wealthy, but we can do that much. That's just a little bit. And then she kind of paused and she said, well, but it's more time. It is a lot of time. And so, while CFS, the country fresh stop sites, the market-based model, they benefit from the produce bundles being directly delivered to them. The impetus was on the donation station sites to come to the produce distribution events that were hosted by community food initiatives. So they didn't have that benefit of the produce kind of showing up on their doorstep on a weekly basis. They had to come get it. And this was, of course, incurred gas costs and this is a pretty rural region, and so there are definitely outlying organizations for whom this was a pretty big barrier to them. It's also worth noting that for donation station, these are a lot of organizations which aren't even a lot of times formalized nonprofits. They're really, churches and other organizations or groups that just are taking it upon themselves to serve the community in a volunteer capacity. And I think there's a really interesting literature in the nonprofit space around volunteer capacity and the aging nature of volunteers in these settings. And that certainly was true, and it did come up in these interviews as well. The older adults I was talking to that were really representing and spearheading these efforts and engaging with donation stations talked about having to recruit, volunteers that could do the lifting and handle these many pounds of produce that they were trying to transport back and forth, and that being another kind of negotiation that they had to handle on a weekly basis. So I think what's really just interesting here is this tension between mission achievement and their desire to help and to do this and to participate, but the participation costs being something that it's tangible to them, that kind of that mental negotiation, and it suggests that program commitment may degrade over time. This risk was quite interestingly apparent among representatives of the nonprofit agencies as well that we were working with, those key kind of liaisons in the model. So this particular partner said, yeah, I think that's another line that we walk, just trying to accommodate as many people as possible. We try to identify where there's give on both sides and somehow come together in a way that's sustainable for everybody. Ideally, that's the way it works. I think as an individual, I would maybe tend to say yes and spread ourselves too thin in order to accommodate people rather than asking them to come our direction a little bit. And this is a great example of how this partner is really admitting that as an individual, they're doing things toward the success of these models that goes above and beyond what maybe the nonprofit itself has committed. And so, really wanting to foster those relationships, not compromise them. And so stretching themselves thin in terms of who they're serving and how often and how accommodating they're being throughout all of this. Because as you might recall, for the Country Fresh Stop model, Rural Actions staff are working with each individual site to ask, what's your budget this week? What kinds of produce are you interested in getting? What sold well last week? What didn't? And just constantly reevaluating those bundles of produce that they're procuring for each site. So there's some international relations literature that discusses how state actors may pursue activities in line with their identity, our identity as, as a country or as a state, even at the long-term expense of their own physical existence, which is like fascinating in and of itself. But this struck me as being applicable here as well. How thin can a resource-strained nonprofit spread themselves before really compromising their value to the larger system at hand, in these models in particular? So that brings me to phase 2. And this phase is really in line with the value of sequential mixed methods approach. Our initial qualitative inquiry from that phase 1 generated valuable insights into these models that really can stand on their own. And in fact, we're working on revising a manuscript as we speak. We're going to submit it to Agriculture and Human Values. I think that's a great outlet for this work. But really, the core purpose of that initial formative phase, yes, we have to publish, that's expected. What it did, though, is it gave us a much deeper understanding of these models before we tried to attempt to quantify anything and measure program exposure, program impact. So one thing that we learned, for example, during that qualitative phase, is that a lot of sites admitted that they hadn't really been taking advantage of or been doing a great job, despite the provision of marketing materials, to really market the program in a way that would allow the consumer to realize that they were benefiting from Country Fresh Stops or from Donation Station. It was so integrated into their operations, and Rural Action and community food initiatives themselves admitted, we don't care really if people recognize that they're benefiting from these models. We just care that these models are benefiting people, which is great. You know, it's so altruistic of them. But from a measurement perspective, that creates problems, because we can't just ask people like, have you used Country Fresh Stops? They may not know. And so how do we word these questions to really get at and try to understand where they're sourcing food from, how often, and then on the back end, making connections between, oh, these locations where they're sourcing food from and where they're sourcing produce from are affiliated with or not Country Fresh Stops and Donation Station. So one thing that I want to mention here too is, of course, COVID played a role, as with so much research in the past year. And so we ultimately, while we wanted to do like on-ground in-person data collection, you know, do maybe some biometrics and, you know, try to get some harder outcomes and really capture and observe firsthand who was using the program, recruit them into our study, so we could really make sure and focus that we're focus our efforts on individuals who are exposed to varying degrees to the benefits of this program. But of course we couldn't. So instead we did a longitudinal remote study of program utilization, self-report, and diet and health outcomes among the regional consumers at large. What did that look like? So because we had to rely on remote data collection, we're like, how are we going to recruit people to this study? And it's a rural location, there's known internet issues. And so we didn't really want to do like a social media launch. Mail's where it's at. You know, my dad's a mailman too. So of course I'm thinking like pretty much the only thing we get these days are like those spam, like I'm running for office, or like this you know, this new company has opened up in the area, like come shop here. And I was like, could we do that for research? Turns out you can. So through the United States Postal Service, every door direct to mail, their kind of junk mail service, you as a researcher can work through a third party to send postcards to every single residential address in a given region. And that's what we did. So we found the 18 zip codes that overlapped with where Country Fresh Stop and Donation Station sites were functioning. We sent every single household a postcard, all 31,000 of them in July. It was really late June, early July of 2020. And on that postcard, this is an image of it, on the back, we introduced ourselves and told them about the study, summarized it really briefly. We're interested in, you know, where you buy food and your diet and or what you eat and your health, and invited them to take the survey either online. We had a short link, QR code, and we also gave them a phone number that they could call for a mailed survey. And so we actually had 724 people respond, which I was pretty pleased with given the tumultuous nature of the world. 32 of which, for those of you interested in methods, 32 of which did take the opportunity to respond by mail. And interestingly, more people over the course of the study opted to take the survey by mail rather than online. And that's something that we want to kind of look into more and understand. This survey, just so you know, of course, we had to rely on self-report. But it asked about food sourcing routines. So not only where they shopped for or accessed food, but also specifically where they shopped for or accessed fresh produce, including whether or not they gardened, and asking them details about that. It also, in terms of outcome, asked about food security status, and we did use the prioritized space in the survey for the full 18-item USDA measure. We looked at fruit and vegetable intake using the National Cancer Institute's fruit and vegetable screener. And we also asked about self-reported health status and a suite of other health-related behaviors. So we're about to launch the final quarterly survey. And so obviously I don't have final analyses for you, but we have started to conduct preliminary analyses with data from the initial time points. And, you know, food security, I started with this and I'll bring it back up now. Of course, it's at the forefront of public health concern related to COVID and the related recession, and the clear demand that we've seen across the country for food resources and food assistance. So, obviously our study suffers from a convenient sample, and our sample is not representative. But it may still be of interest to know that we did find, as we would expect, and as we see in other published literature, a significant difference in household food security status in July of 2020 between households with and without children. So for those of you less familiar with food security measurement, we score those 18-item responses to really categorize people into high food security, that is fully food secure, marginal food security, which is typically lumped with food security, but that's a contended area of concern, and then low or very low, which are collectively called food insecure. And so we observe a food insecurity prevalence among households with children of 24% if we add these yellow and gray slices, which is actually almost exactly in line with the 2019 estimates of food insecurity among households with children in the county then. So I kind of think that's interesting. Given the desired impacts of Country Fresh Stop and donation station models, we're also, I'll share with you, my research associate Patrick's on the call, and he's been so kind to be like, you're really digging into this data, which are non-ideal in so many ways, but really figuring out how we can make the most of it. And we're heartened to observe that sourcing fruits and vegetables and just exposure to donation station locations in general is positively associated with self-perceived health status when we control for household income, number of adults, number of children. And so, I think, of course, this is all preliminary, but these are the sorts of questions we're going to try to answer, because I think what's so frustrating to those of us in the research world is it is often hard to really demonstrate that value and health impact that these programs are having, just because of the nature of the system, the complexity, and the time horizon over which we are likely to see those impacts and be able to measure them. So, although the convenient sample is not ideal for assessing population trends and key outcomes as it relates to program exposure, it has allowed us to identify households in the region for which household composition has fluctuated. And we know, we're actually doing, as part of a different study, that household composition really matters. I mean, it's so intuitive, like the number of people you have in the households, the number of children, their ages, like all of that really matters to food security, to household resources. And so it's something that is of interest to us. But we're also able to identify how food security has fluctuated among these households over time within a year, in households for which food security hasn't fluctuated, where they've been either consistently food secure, which is great, or consistently food insecure. We're also interested and have identified households that have differing degrees of engagement or utilization with the two programs of interest for this study, Country Fresh Stops and Donation Station, and are able, because of our survey and that back-end matching we did, to identify, okay, who actually is exposed to this, and then follow up through these one-on-one interviews that we're about to do, and ask them about these quantitatively measured fluctuations in their household, and really opens the door for us to recruit a very purposive sample of households to interview that really reflect the diverse experiences across all these strata, and can help us to explain and really understand better than we can ever, in my opinion, through quantitative data, these quantitatively captured shifts in household circumstances. So for example, I'm almost done here. Food security, of course, is central to all my work, and one part of the interview guide really involves sharing the formal USDA definition of food security with the interviewees, and then checking with them, just having like a really frank conversation of like, does that resonate with you? Our measure says you're food secure. Would you say your household's food secure? And I can tell you already, there are households who have already reached out to us and said, your survey is going to say I'm food insecure, but that's only because I'm working 2 jobs, and I'm hustling very hard to make sure our household's food secure. So yes, I'm food secure, but precariously so. And that's the sort of thing that I think is going to come out in a more formalized nature in these interviews. Of course, we don't generally have hypotheses for qualitative work, but based on some of these conversations, I do expect that to come out. We, though, at a broader sense, hope to answer questions like, what factors, events, or resources do households cite as instigating their transitions into and out of food security? And are CFS and DS perceived as key community resources? And as researchers, we have to be prepared, and our nonprofit partners have to be prepared to hear the answer no. Based on our preliminary analysis of the data and just looking really descriptively at what people are reporting, there is like pretty minimal utilization of these sites for the purposes of fruit and vegetable procurement. And that could be related to a lot of factors, not the least of which is COVID. And we actually did have a participant reach out and say, by the way, my engagement, like she person used the word engagement, where I shop has been impacted this year by COVID. And, I just want you to know that, because usually I would shop at these locations, but they weren't able to accommodate some of the same safety measures that the bigger retailers were. And I just wanted, I preferred to buy produce online and do either delivery or pickup or things like that, which of course these small retailers and sites just weren't able to do in that period. So we have some major confounding issues to deal with, but hopefully can still generate some helpful insights. So let me conclude then. My first conclusion is that mutual benefit and value alignment, both between and within stakeholder categories, those personnel at that stakeholder category that I talked about, that seems key to program sustainability. And I just want to say too here a point as interventionists. I was trained as an interventionist, really, that is, someone who kind of designs and implements and tests these public health or nutrition interventions. We often think about the elements of our approach and the methods by which we're going to influence behavior and the methods by which we're going to capture its impact. But do we think about the people? Who is involved? What are their values? How might that influence their buy-in to be implementing this intervention and the long-term commitment to the effort so that the intended impacts have a chance at really being realized? And I just think that's so important and probably doesn't get enough credit in intervention, implementation type science. In academia, intellectual capital is what it's all about. But I just think, the more I do community engaged work, the more I dive into a lot of this, I'm just realizing how key social capital is. And some of those kind of, I don't know that soft skills is the right word, but the values, the personal attributes, the beliefs of those individuals who are being tapped to implement the intervention is actually quite important. And typically when we do training for intervention implementation, we'll focus on the technical aspects, the procedures, the processes, but we don't focus on the people themselves. So I belabor that a little bit because I think it's actually really important. Second, the seasonality inherent to programs that leverage local produce really undermines the continuity of their implementation and thus likely undermines their impact and their durability. And so we see this in the literature with locally placed seasonal interventions that they might have impact while they're being implemented, but then we lose that impact once they're no longer implemented, or at the very least, it slowly tapers off over time. So it makes sense when it comes to food. I mean, food is a constant need. This isn't, a fact to be learned or a skill to be mastered. It's access to food. And so, the question that comes from this then that I'm just constantly thinking about is how can we advance these laudable interests related specifically to supporting the local economy and to local farmers and improving community food and food security. I don't know if you could hear him, Marshall's laughing in the background, while also addressing this key limitation toward the durable achievement of food security and the health aims. Finally, program stewardship. That is really the self-initiated or self-initiative that is exercised by staff and by sites. This may enhance short-term gains, for example, reach. So sites talked about, how they really, continue to participate in the program for the time being because they think it's valuable. So of course that behooves reach. And, some quotes I didn't share talked about just little things they did at the site level, like creating recipe cards and holding taste testings and doing these things that are small, but that still take time and resources to help amplify the program's impact. But things like this, potentially, they have long-term costs to sustainability, we would suspect, and might degrade commitment over time. So I think it's really important for us to grapple with this as academics. As academic appreciation grows for pragmatic and adaptive study designs, what are the acceptable bounds of such adaptation and stewardship within these models while we're balancing the aims of reach and impact? So I kind of feel like I'm leaving you with more questions than answers, but I think that is probably just how research goes, and kind of what I love about it is this constant journey. So um, I think it would be a misrepresentation of this ongoing effort and really an injustice to the murky waters of food systems to be more definite than I am here. My hope, though, is, of course, that you've picked up something helpful. Maybe you've learned more about mixed methods. Maybe you have a greater understanding of the promise and potential pitfalls of short value chain models of healthy food access. And maybe I've just got you thinking more about your own work and your valuable contributions to the science of health, really. So with that, I end by sharing, the great dynamic team that made this all happen, our nonprofit partners, my own research team here on the right. This isn't all of them, but these are the ones who have just been, Kathleen, Shavar, Patrick, who's on the call, and Kola have been involved in helping to analyze the data and really make it all happen. And of course, I would be very remiss to not thank our participants who are engaged in this work during such a crazy time. So it's just we're very appreciative of that. And of course, to our funders. And I love this picture. This is at the auction in question, and it's pre-pandemic, late 2019. And what might be not super apparent is Marshall was in tow here. Here he is, little peanut before he was born. And that actually brings me to my final thank you. And especially, right now, I can hear Marshall and Tom in the background, and it's just they're my team at home, and they helped make all this happen and allowed me to say yes to your kind invite, quite frankly. So I owe them thanks as well. So thank you for your time. I know I went a little over. My passion gets away from me, but I'd be happy to answer any questions you have and engage in great discussion. So thank you.
Excellent. Thank you so much, Dr. Gardner. Looking at the chat, our first question comes from Dr. Keller, and anybody else, if you have a question, please put it in the chat and I'll make sure that she gets it. So Dr. Keller asked if any of the stakeholders in the study talked about fostering other partnerships that could help with stewardship to manage these kinds of consumer expectations during this ebb and flow. An example she gave would be SNAP Ed, other community nutrition programs.
Yes, absolutely. They did do that. And that was part of what it created efficiencies for stewardship because, of course, they were kind of outsourcing some of that. Even like they had the occasional dietetic intern, hosting taste tests and things like that, which is great too for the students to get that experience. But because especially with students, there's that influx and kind of flow. You can't always rely on it. With SNAP Ed, they were able to incorporate some of those more consistent resources, working with extension at the local level for some sites. But in their effort, I think, to be adaptive and to really meet site level needs, it seemed like every site was doing something different. So maybe the extension resources they were working with or the representatives couldn't spread themselves across all the sites. So maybe there were 2 of the biggest sites that had some extension programming every now and then. But it really created, from a programmatic and evaluation perspective, a lot of differences. And that my sense from talking with them over these past 2 years has been that was also, though, a constant negotiation of, can you do that again this year? How often can you do it? When? Where? And so while it did outsource some of that, it still created burden for them, ongoing burden for them as well. And so I think, to your point here, I think that relationship should and could be more formalized than it currently is.
Excellent. Yes, Dr. Lindberg.
Thank you. I was going to type it and it was too detailed. I couldn't figure out how to type it, but thank you. That was great. And it reminded me, we had a presentation earlier in the semester about working with the community members when interacting with your research participants. And I'm curious because qualitative data is definitely outside what I do, but it seems, for example, the study you said where you're doing the follow-up questions in person, where you want to learn about what happened over time with food insecurity. Who does that for you? How do you train someone? Because I think to get robust data, you need really open conversation. So how do you approach that?
Yeah, that is a great point. I've been hosting trainings, and it is really hard in a virtual environment. And these interviews are going to happen virtually because, we still haven't, which is good. I haven't eased research restrictions here at least. But so to do that, we have been talking about those soft skills that I mentioned during the presentation because it is an art. Yes, this is science, but talking with people in a way that invites them to open up, especially around something so vulnerable as food security and accessing food resources, that takes a certain nuance. And so, yeah, I very consciously engage in training with my students, practicing, and one thing, what we're going to do for this particular study is I'm going to take the lead. I'm going to be doing a lot of the interviews for probably the initial 10 to 15, and having at least one of them, probably just one of them, we don't want too many people on the call, sit in and be the note taker so that they can get that firsthand exposure to that. They can still engage meaningfully. We need to have a note taker, but they can also kind of learn and observe that process. And slowly I can hand off some of that to them and allow them to get that experience. Because I know during my doctoral training, it was kind of like learning, learning firsthand. I actually didn't have as much of that training as I'm hoping to give and as I'm giving my own students. And so those first few interviews were a little rough. You didn't get as much good data. You kind of learned over time, like, oh, this is a good way to build rapport. Let me just start with a simple question like, how are you? And, oh, I see you have children, I have children, things like that, where you get people comfortable and show that you're a human. I'm a researcher, but I'm also a human. And I want to do something here that is valuable and beneficial for the community. And I can't do it without you. And so you're really engaging in a partnership with that individual for that amount of time. So I could go on and on about this, but I won't. Does that answer your question?
Yeah, it did make me have one more quick one. So if it wasn't COVID, would the interviews be in the community or would they be coming to the research laboratory, or how does that work?
No, and those initial interviews were done in the community. So we, as much as possible, as much as resources allow, we go to them and we find a neutral space where they can be comfortable, but it's still private. And so how we did this for those initial formative interviews is gratefully, I talked about AceNet, they had office space that we could use in the Athens region. And so we invited people to come there. We took up shop in one of those offices for a few days each week. And therefore they had to travel to come to us, but it was maybe a 5, 10, 15-minute drive as compared to Columbus is, hour and a half or more from Athens.
Thank you. That was a great presentation. Thank you for coming.
Thank you.
Dr. Parks had a question in the chat and it gets at what we were talking about before as well with your path to becoming a dietitian and those very cool internships that you had. But her question most specifically was about where students post-graduation, where they go after that. And if you could talk a little bit about your experience and your path, I think that would give students another idea of what the possibilities are.
Yeah, absolutely. So post-graduation, which degree? Bachelor's?
Yes.
PhD, bachelor's?
Yes.
Okay, both. Okay. Yeah. Okay. So, I think there's probably endless answers to this question. So I'll just share, like you said, my own trajectory. That is, so I'll share some personal background. Actually, it might be helpful to give some more and more researchers, especially in the qualitative space, we're the vessel through which data is traveling. So our position in the world, our identities are actually very important. It might sound warm and fuzzy or whatever, soft, but it's actually very important that we recognize what we bring to the table and our own trajectories through life. And so actually, I grew up in rural Michigan and in a low-income household. And when I was in high school, I took this career class where we had to explore options. And at that time, I grew up in the type of community where like nobody really leaves. They might leave to get a degree of some sort, but they come back. And so that was my plan too. I just thought like my town was, the bomb and wanted to make sure I lived close to my family and all of that. So anyway, I realized dietitians make at that point, I think the average salary was $35,000 a year or something like that, or at least in my region. And I thought that sounded incredible because that was more than my parents were making combined. So I was like, this is good. And there's good opportunities at home. They couldn't recruit dietitians because nobody wants to work in the middle of nowhere. And so the hospital actually told me, go get your degree, come back, we'll hire you. And actually, fun story, they did call my mom actually after I hired, and they were like, is Jennifer done with her degree? And she was like, she is, but she's actually in New York now. And so hopefully they found someone. But so I went to get my degree, Central Michigan, 2 hours down the road. And there they I was in the honors program because of a scholarship that I'd received, and they did a very good job, for better or for worse, of identifying students who were first generation. That is, they were first in their family to get a bachelor's degree, and were low income. And so they realized quickly, they're like, oh, Jennifer's in this bucket, and they kept reaching out. They're like, we have these programs for students like you. We want you to have a great experience. And I kind of ignored them for a while because I was just hyper focused. I'm like, I know why I'm here. I'm getting my degree. I don't need to do, anything else. But finally, I succumbed to their invitations to this program. And the program, turns out, was very focused on research experiences. And so really building the diversity of the pipeline for the professorate and making sure that, or trying to enhance opportunities for first generation, low income and underserved students to get those formative research experience that can open doors after graduation. A caveat of this program is that they get credit for you if you go straight into a PhD program after your undergraduate, which is just like incredibly ironic because you're taking this at-risk group of students. Some of you probably heard me say this before the call. You take this at-risk group of students and you're like, you now need to go straight into a PhD program. And there's so many PhD programs that don't even accept students out of undergrad. So anyway, I'm not in charge. I didn't make the rules, but I did say, I was like, I'll apply to one program. I'll apply to Cornell's program because it combined the dietetic internship with the PhD. And I think there's one other program that does this, maybe University of Illinois, or at least at that time. So I applied, and they accept one student a year. So I was like, I'm gonna be fine. I'll be staying in Michigan. It's all good. And at that time I was dating my now husband, and we were at this like really formative spot in our relationship. So I was like really, pretty bent on sticking around. But dang if I didn't get in. And I knew I had to go, it was just one of those things you knew in your gut, like this is too good of an opportunity to pass up. So I went, I was there for a year without Tom, and, gratefully he was able to join after a while. He was just transitioning into the workforce too. So it was such a journey for us personally, but professionally, I will say that the internship, the way the program was set up was that you did I did 1 year of coursework to kind of make up for the fact that I didn't have the master's degree and kind of cram that all in. And then I did 1 year of the dietetic internship with all of the other dietetic students, internship students that weren't in the PhD program. And it was a research focused internship. And so through that, they set us up. They allowed me to be part-time in the internship so that I could continue my doctoral work and build those relationships that I would need to do my research. And so that's where I got to spend some time at WIC for half a year, the supplemental nutrition assistance program for women's, infants, and children, and also spend half a year at the University of Rochester's Medical Center, which is just a great system and a great learning opportunity. So a really, really diverse experiences. And I think you had a question before the call too. This program also required that I do a policy internship because that was really part of the goal here. Of course, every program has their mission and their hopes for their students. And their hope was that dietitians would gain, and the dietitians, PhD, RDs graduating from their program would have a greater appreciation for, engagement with, and impact on the nutrition policies that so impact the communities we're serving. And so they hooked me up with the National Academies, National Academy of Medicine, and I spent, I think it was the spring semester, it was a few months of my final year in the PhD in Washington, D.C., in the National Academies building. If you haven't been there, it's just incredible. And so it was a very, very cool experience. And actually, now that it's spring, D.C. was an amazing place to be in the spring. I will say it wasn't great doing a full-time internship while also finishing my PhD, but it all worked out. And I think, to answer your question in a way that is maybe more helpful and broadly applicable, that research experience all along the way, I know so many people for whom they don't get a PhD. But having that research experience, you learn really translational skills through that, like communication and writing, communication audibly, visual. And all of that is so important to be able to engage effectively with patients and clientele. So I would say it is a worthwhile endeavor, whatever level you're at, to get an experience like that. And now I've just gone on, but hopefully that answered your question.
I think that was wonderful. I think that characterized well the very cool experiences that you've had and being able to take that away for all of us. So I want to leave the moment if anyone wants to add any other questions. We are slightly over time, but that happens whenever we have great presentations and great thoughts.
Oh, thank you for the clapping. I see it popping up. You guys are so kind. Thank you.
Oh, Andrew has a question for us. So he would like to know if you've noticed any cultural demographic trends within the populations that engaged with these services, or in general, more likely be food insecure.
Yeah, great question. We actually just ran those. Patrick's probably smiling on the call here. Ran those statistics. He did, comparing the demographic attributes and the household attributes of those who engaged with the program versus those who did not. And by and large, we actually didn't see any significant differences. I think what we saw, I should pull it back up here. Let me do that to make sure I'm not misspeaking. This is all pretty hot off the press. Yeah, so the significant differences for Country Fresh Stop that we saw, the significant differences were that those who engage with Country Fresh Stops or had used or purchased food from those locations had more children in the household. These are significant differences at the P is less than 0.001 level using a Mann-Whitney U test because of non-normality. Anyway, they had more children, greater household size in general, and of course, not surprisingly, had about half the income. The mean income was about $30,000 for households that were using Country Fresh Stop locations versus $66,000 for households that were not frequenting Country Fresh Stop locations. Does that answer your question?
Kind of. I was also a little curious about the racial demographics and like how that kind of like broke down into the uses and the engagements for these kind of services.
Yeah, absolutely. So, I think I'll just stay up front that Southeast Ohio is, for better or for worse, not diverse in terms of race and ethnicity. And so when we looked at that, there were no significant differences, but in general, I think I actually have a slide on this. So let me go to it. Those little, I would definitely recommend when you give presentations, you have all those little backup slides that you go to. So let me find that for you. Pull it up here. Here we go. Okay, so in terms of who responded, at least, this is a total sample, 724, primarily female. This happens in, pretty much every study I've done, it's primarily female respondents, although only 68%. Usually it's something like 80 or 90% for the studies I participated in. Middle age, truly 53 was the mean. But then we see racially, very little diversity, ethnicity. Across the education domains, you can see here 64% were college graduates, but I think in the current economy, education is really, no longer, I don't think it's a good proxy for socioeconomic status, but that's a conversation for another day. What we did see that was interesting is a preponderance in terms of employment status, and a preponderance of our respondents were retired, not a preponderance, but a surprising percentage, nearly 30%. And so that might be a function of who had time to take our survey during a pandemic. I think I might have one more slide on this. Oh yeah, so in terms of household composition, we had a pretty good split in terms of number of adults. Most of the households did not have children, 70% did not have any children. Household income was, the most frequent category was less than 50,000. But I think what's really interesting and relevant to some of our other work is these households, 37% that had 3 or more adults. Like who are the other adults in the household? Were these adult children that had come home from college and were living at home because of the pandemic? Are these households with a grandparent who is joining, is part of the household? Or are these households of grandparents with, you know, an adult parent living with them. And so that's definitely something that we're going to be exploring more in the this second qualitative phase of the work. So did I answer it better now, Andrew?
I mean, it did, but it also like it ended up giving more questions to it. But I feel like you all will be investigating those questions and even further, and hopefully maybe even coming back with more answers.
Yeah, absolutely.
Excellent. And if
Thank
I
you.
might add, I'm sorry, Andrew, if I might add on just a little bit, there is here at Mizzou some very similar work that Dr. Garner does, the Interdisciplinary Center for Food Security. So you could look at Missouri data, but one of the things, full disclosure, before I started teaching as much as I do now, I did that I was boots on the ground at the food pantries doing that. So I totally get it. I remember got a little bit of a heat stroke once doing surveys in the middle of July.
Yes, same.
But you can find that data for Missouri if you want. And I'm happy to help out with that if you want to find it, or put you in touch with who's still doing that if you're interested in that right now.
Yeah,
Absolutely. Yeah,
Perfect.
I think you're
That'd be
talking to
great.
Andrew, but I'm always so happy
Sorry.
to totally happy to collaborate and just connect. And I think I just wanted to make sure to mention that too. So
Yes, absolutely. I will send it to both of you after we're done here. So Dr. Parks, I see you're unmuted. Did you have something you wanted to add?
No, I just wanted to thank her. I thought this was wonderful.
Okay.
Oh, thank you. Thank you, Dr. Parks.
I want to, again, be good stewards of time. There were lots of fire up chips and go chips whenever you were talking. I presume that has to do with Michigan. I did not want to Google while I was paying attention, but a lot of things. This was a wonderful talk. It was one of my favorite times of research, was getting to do this work as well.
Awesome. Yeah, I'll have to look in the chat. So Fire Up Chips, just so you know, Jennifer, is Central Michigan University, our mascot. We're the Central Michigan University Chippewas, and it actually has to do with a deep and valued history with the local Chippewa tribe. And so that is the rallying cry of Central Michigan University students is Fire Up Chips. So yes, thank you guys. Sounds like we have some kindred spirits in tow, but wonderful, wonderful. I kind of want to, okay, food insecurity. Thank you for that link. Yes.
Yes. And William McKelvey, and I am totally going to butcher his last name because I'm terrible at spelling. But he should be the director now, and that's a person you can get in touch with.
Okay, fantastic. Well, gosh, thanks for all the thanks. Thanks for having me. And I think I should have put this back up, but my email, I hope I put it on here somewhere, is right there. And so please do reach out if you have any further questions or want to chat. So thanks everyone for sharing your evening with me.
Thank you so much, Dr. Garner.
Bye.